We're in the CVICU, our cardiovascular intensive care unit. This is our high acuity unit where we take care of folks who have heart, lung, and other kinds of severe organ failures. Of our 12 beds, we can see 6 or 7 right here. These are all COVID ECMO patients that, quite frankly, have been here for multiple weeks at this point. And for most of them, they will be here for several more weeks or more.
If they come to this floor, it's for ECMO specifically. So we have to cannulate them to put them on a machine that takes all of their blood out of their body, circulates it through a machine to get oxygen, and then put it back in their body. So we're putting, big cannulas in their neck and then FEM to just kind of recirculate their blood and make sure it's getting the oxygen it needs because their lungs can't do it for them. So the COVID patients we're seeing are very, very sick.
ECMO at some level is kind of like science fiction for people who have no background in it. At a base level, it's not an entirely complicated process. It's a pump that goes through an external membrane, which works as a lung, and then it goes back, and depending on where you put your cannulas in, it can either work as support for your lungs or for your heart. But the way that it works with your physiology, and it's a game changer. It offers an option for people when there is no other option. It's both kind of magic at some points, and it's also really scary at points too, because at any moment things can go really wrong.
During the first wave, we didn't have nearly as many ECMO patients. We were upstairs. They would cohort them still to the 10th floor. The surgeons would cannulate, and then the nursing staff on 8 are the ones trained to take care of these patients, so we would go up there.
During that first wave, we're older, probably around in their 60s or so, 50s and 60s. And we didn't have, at the height of it, probably last year, we had probably about 8 people on at the most. And now it's dramatically different. The age range of people that are requesting ECMO is now, most of our people are between 20 and 50 years old. And we have a wait list right now for people who are desperately needing ECMO. And whenever we have a circuit come free, we have to call these facilities and get updates and try to figure out who the best person is to give them that opportunity.
Everyone was exhausted last winter, and then it seemed like our numbers were down. They decreased. Seemed like we were having more vaccinations, and then it stalled. Everything opened back up, and it did seem like everything was getting back to normal. Then the infection rates increased. Our hospitalizations, we've watched those increase exponentially. Really, honestly, everything that every healthcare provider feared would happen May of 2020 is happening.
I feel like, especially with this wave, there is a huge discrepancy, I think, between what goes on here and what goes on in public. I don't know that people understand how dire these situations can be. I personally feel, and I know I've had conversations with other nurses, that this is worse than before.
Our staff has been phenomenal. Every time we've asked, they've given. I think for me, my problem is that we've asked and asked and asked and asked, and they've given and given and given. And they're great, they're wonderful, but boy, are they exhausted. Boy, does it hurt emotionally.
I'm originally from Arkansas, and have been hearing for the last month about how the hospital I used to work at, that all my friends are at, has been at capacity for a month now, and a lot of young deaths. They are seeing a lot of 20 and 30-year-olds dying. I had somebody I know from high school who died this week. Yeah. So they're all unvaccinated, and that's hard.
We've had pregnant mothers on. We've had young, strong men on. It doesn't know any boundaries. COVID doesn't care. And that's been really hard because we've seen some of those people have really bad outcomes. Pregnant people have lost babies. We've had young people not make it, and that's heartbreaking.
You become invested in these patients. You become invested in their families and their stories and their communities and who they are. And then to lose them, or to see them here again after being off for a week, or seeing the heartbreak and the headache and the awfulness of all this. is hard. It's hard on all of our staff. It's another way that we don't think about that we're asking them to just give. And they do it, but it's hard.
There's still so many people who are so adamant about not getting vaccinated, but they're not seeing how it's affecting everybody here and how we are all like fighting for people to stay alive.
They're sicker than before. We didn't have this many ECMOs, we didn't have this many people this sick, and we didn't have people this young last time. I think that's probably the biggest thing for me, is coming in here, doing this, seeing how bad it is, and then going to Kroger afterward and seeing just the gap.
I think one of the most important things that I would want people to know is that we will do our best for you, whether you're vaccinated or whether you're not. I would encourage people to read the evidence that's out there, to not seek out medical advice on social media.
It's very important that you just get vaccinated, essentially. That's the easiest thing that anybody could do to help anybody else around them, is to just get vaccinated and wear a mask.
If you get COVID and you've been vaccinated, you don't get as sick. You are likely not going to be in the hospital. And if you are, you're not going to be as ill.
Understand that COVID is real, that COVID is serious, that COVID is life-changing in ways that we don't even understand today. For our families, for our patients, for our staff, COVID is real. And so take opportunities, take the chances that you have to protect yourself, protect your family. Vaccination, masks, social distancing, take it serious. Please don't become one of the patients in our units. Please don't let your family become a patient in our unit.